Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5, as well as the professionals who work with them. I'm your host, Dr. Stephanie Dueger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies and children from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Welcome back to Prepared for Parenthood. Last week's podcast, we had a guest on, Katie O'Toole, and she spoke a little bit about the postpartum rage that she experienced as a new mom. The truth is that many parents experience this, but almost nobody talks about it openly. Postpartum rage is not just irritation, it's not just stress. It's moments of sudden, overwhelming anger that can feel frighteningly confusing, deeply out of character for how you know yourself to be. You might snap at your partner. You might feel furious over something that's really small and insignificant. You might even feel like you're watching yourself from the outside and wondering, who is this person? If that resonates with you, I want to start with something important, which is that you're not a bad parent. You're not broken. There's something wrong with you. You're definitely not alone. And in fact, postpartum rage is increasingly recognized by clinicians and researchers as a real and biologically influenced experience during the postpartum period. So today we're going to explore a few different things: what postpartum rage actually is, what science tells us about the hormonal shifts after birth, why anger is often overlooked in postpartum experience, and how this connects to both premenstrual irritability and rage and perimenopausal and menopausal rage later in life. Because interestingly, these cycles of life all share something pretty profound. They all involve rapidly shifting hormonal transitions in the female brain. So let's start with postpartum rage. Postpartum rage is not a formal diagnosis, but clinicians will use that term to describe intense anger, irritation, or explosive irritability that can occur after childbirth. So for some parents, it looks like yelling or snapping unexpectedly at someone, feeling constantly on edge, having a very short fuse or zero bandwidth, or feeling overwhelmed by anger and then experiencing guilt or shame. Research suggests that anger is actually a common but understudied emotional experience in new mothers. One study explored postpartum anger and found that mothers often described rage as sudden, intense, and deeply distressing, especially when it didn't match their identity as a new parent. And here's something important. Postpartum rage is often linked with other perinatal mood conditions, including postpartum depression and postpartum anxiety. So if you are experiencing this a lot, please seek out support from a qualified healthcare professional for extra support. Culturally, we expect mothers to feel happy, joyous, tender, and just be loving all the time. But anger does not fit that cultural image of motherhood. So many parents just keep that hidden. To understand postpartum rage, we have to talk about biology and the hormonal storm that happens after birth. So during pregnancy, estrogen and progesterone rise to extremely high levels. Then within hours after birth, those hormones plummet dramatically. In fact, the drop in estrogen and progesterone after birth is considered one of the largest hormonal shifts in all of human biology. These hormones don't just regulate reproduction. They also regulate the brain, Estrogen and progesterone influence serotonin levels, dopamine levels, stress responses, and emotional regulation as well. And when these hormones drop quickly, brain chemistry temporarily shifts as well. For example, declining estrogen levels can reduce serotonin activity, which may increase irritability and mood instability. At the same time, progesterone withdrawal may contribute to anxiety, agitation, and emotional reactivity. Now, layer on top of that severe sleep deprivation for a new parent, physical recovery from birth, massive identity changes, constant caregiving demands, and you can understand why the nervous system becomes incredibly taxed. Johns Hopkins researchers note that sleep deprivation alone significantly increases anxiety and irritability in the postpartum period. It can also exacerbate perinatal mood disorders like postpartum depression. So, postpartum rage isn't just emotional, it's neurological, it's hormonal, it's psychological, and it's environmental all at once. So, many people assume that postpartum mood disorders look like sadness or crying, and they do sometimes, but anger is often a protective emotional response. Psychologists sometimes describe anger as the body's way of signaling something is too much, something feels unsafe, something needs attention. For new parents, that might look like the chronic exhaustion, the lack of support, sensory overload from a baby's cries, unrealistic expectations about motherhood. Anger can also signal when a parent feels trapped between impossible demands. You have to take care of the baby, recover from birth, sleep less than ever, be grateful, be patient, be loving. That's a lot for any nervous system to. It's also important to know that postpartum rage often appears alongside other perinatal mood conditions, like we mentioned before. About 10 to 20% of women experience postpartum depression, and many more experience milder mood disturbances. In fact, researchers estimate that up to about 85% of mothers experience some form of mood disorder in the postpartum period, even if it's temporary. Anger can be a signal that something deeper is happening emotionally, but it can also exist just on its own, which is why it's important for healthcare providers to ask you about anger specifically. Now, here's something additionally fascinating: the hormonal transition to postpartum and the hormonal transition of perimenopause share striking similarities. Both involve dramatic hormone shifts, changes in estrogen and progesterone, effects on serotonin and emotional regulation. And during perimenopause, estrogen levels fluctuate unpredictably before they decline. And these changes can lead to a lot of mood symptoms, including irritability, anxiety, and anger. Researchers have found that estrogen influences brain systems involved in mood regulation. And when estrogen drops, serotonin signaling can also be affected. So, this is one reason why some women report what people sometimes call menopausal rage. And there's an even deeper connection. Women who experience severe mood changes after childbirth may be more vulnerable to mood disturbances during menopause later in life. Some researchers believe that this is because certain brains are more sensitive to reproductive hormone shifts. In other words, it's not the hormone level itself, it's actually the brain's response to hormonal change. There's another important piece of this conversation, and it starts long before pregnancy or menopause. For some people, the first clue that their brain is especially sensitive to hormonal change shows up during the menstrual cycle, often as irritability, anger, emotional reactivity, or mood crashes in the luteal phase, which is the stretch of time after ovulation and before your period starts. Research on premenstrual syndrome, or PMS, and especially on premenstrual dysphoric disorder, or PMDD, suggests that in many cases, the issue is not unusually high or low hormone levels, but again, an increased sensitivity to otherwise normal hormonal shifts. It's about the brain and how the brain reacts to these hormones. That's such an important idea because it reframes the story. For many women, the question isn't, are my hormones abnormal? But rather, is my brain especially sensitive to hormone transitions? These issues during menstruation, pregnancy, postpartum, and perimenopause may not be isolated problems, but connected windows of vulnerability for some people. So if someone has experienced intense PMS or PMDD symptoms, that history may matter. Research suggests that premenstrual symptoms can be a risk factor for postpartum depression. And more recent work suggests that histories of PMS and postpartum depression are also associated with depressive episodes during perimenopause. That doesn't mean it's inevitable. It simply means the pattern is real enough that we need to be paying attention to it. And that helps explain why postpartum rage can feel so familiar to someone who has thought, I feel like I've been this irritable or had this rage before, just not maybe this intensely. The backdrop is different, but the theme may be similar. The nervous system is reacting strongly to reproductive hormone changes. In plain language, some brains seem to be just more hormone sensitive than other brains. And when that sensitivity is present, it may show up in the menstrual cycle, birth, pregnancy, and during menopause. Understanding postpartum rage through this lens changes the conversation and hopefully builds some empathy for yourself and those around you. Instead of asking, why am I so angry all the time? We start asking, what's my nervous system trying to tell me? Because postpartum rage often signals overwhelm, hormonal sensitivity, sleep deprivation, unmet needs, or postpartum mood disorders. And recognizing this is the first step towards getting the support that you need. It can include sleep whenever possible, partner and community support, therapy, counseling, and sometimes medication when appropriate and prescribed by a very knowledgeable healthcare provider. And sometimes just simply hearing other parents experience this too can be helpful because shame thrives in silence, and postpartum rage has lived in silence for far too long. We know that motherhood changes the brain permanently. It literally changes it. Your brain is adapting to protect, nurture, and respond to a brand new little human being whom you are entirely responsible for. And sometimes in the middle of that transformation, the nervous system just gets overwhelmed. Anger doesn't mean you love your child any less. It often means your body and your brain are under enormous strain. And with understanding, support, and care, that strain can ease. You deserve that support. And your mental health matters just as much as your baby's well-being does. If postpartum rage has visited your home, does not mean that you are failing at motherhood. It may simply mean that your brain and body are moving through one of the most profound transitions of your entire life, and you deserve support while you find your way through it. Anger in early motherhood isn't a sign that love is missing. It's often a sign that support is missing. Thanks for being here today. And if this episode resonated with you at all, please share it with another parent who might need to hear it, because sometimes the most healing words are simply, yeah, me too. Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.